Hey everyone, welcome back to the Unspoken podcast, the podcast that aims to discuss everything not discussed surrounding transplant and donation. If you haven't subscribed already, please hit that subscribe button. It helps us get this podcast out in front of more people and bring on more guests and make this podcast bigger than ever. So please, as I said, hit that subscribe button. My name is Anna Morgan Pilardi. I am the Program and Communications Director here at the Chris Klug Foundation and also the host for today's session. This session is going to be all about living kidney donation to pediatric patients. I'm going to be joined by Brian Martindale from Kidneys for Kids, whose mission is all about making sure pediatric patients waiting on kidneys get living donors. So I'm really thrilled to jump into that session with him in a moment. But before that, let's dive into CKF in the brief. If you haven't seen already, our last episode, episode 5, was with our CKF award winners from 2024, and we actually announced our 2025 CKF award winners, who will be joining us here in August for the annual Wine and Dine Gala. So a huge congratulations to Patty Graham, our Hero Award winner, Dr. Ahmed Anoudi, our Bounce Back Give Back Award winner, and Dr. Randall Stafford, our Community Champion. So if you haven't checked out that episode, please do so. Next, we will be headed down to Kansas for the Unbound Gravel with our 16 riders at the end of this month. They have been doing incredible work raising awareness for organ and tissue donation, as well as funds for the Chris Klug Foundation. So if you haven't already, please check out their stories. Chris will actually be racing on this year's team. Next up, we have our Scout and Save campaign, which will begin in June and run through the summer. This campaign is all about helping Girl Scouts achieve their organ donation awareness badge. So if you know any troop looking to get that achieved, please reach out to us. We have a ready-made package with the badges and everything else to help them achieve that goal. We will have a page up on our website so that you can place an order today. It will be the perfect activities and games and education to get them all the way through that badge and encourage them to become organ donors when they get older. For those local to Aspen, our Wine and Dine Gala tickets are on sale for August 22nd. We will be back at the Snowmass Club celebrating the gift of life and having a wonderful evening raising awareness for the foundation and our mission to eliminate the wait. If you'd like to attend, please check out our website /wineanddine to buy your tickets today. Now, without further ado, let's jump into our call with Brian. Well, thanks for joining me today, Brian. I'm really excited to have you here on the Unspoken podcast.
Thank you for having me, Anna.
Absolutely. So Brian is with Kidneys for Kids, a great organization promoting living donation to pediatric patients. And so I want to obviously start that conversation with, where did that idea come from? Why did that get kickstarted in your brain?
Well, started way back in 2012 when I read a story in our newspaper of a 10-year-old girl who needed a kidney transplant. So I had already previously tested about a year and a half before to become what's called a paired kidney donor. I didn't match an adult that I knew, and I was trying to help him. He was medically disqualified for a period. So 2012 rolls around, and I have a clothing brand I was building a store for. And on the last day of building, I ran out of chewing gum. Thank God years ago I had stopped smoking and I took up chewing gum. So I had to have chewing gum. So I walked 3 blocks to this little party store in our downtown, and here's this newspaper story, this 10-year-old girl. She's dressed in a princess outfit. They just had a benefit for her. And says mom had stood on our busiest street corner where our Walmart is, and she was desperate to find a kidney donor, and she just one day was out of desperation, took a pink piece of construction paper and scribbled on it, "My daughter, I can't lose her, please help me," and stood there, and they offered money, but nobody offered to test for Jessica. So luckily the Times, our newspaper, showed up, and our CBS station. So I get the newspaper and I'm reading it, and then I go home, and sure enough on CBS, there's her story on TV. So I'm like, this is something, a sign. And it told me I was her blood type. So I knew I could be a direct match. And she was listed at U of M, where I'd already tested. So I had a relationship there. Oh, it's within 2 weeks, I was ready for testing for her anonymously. And that was in September. And we found out in early November, I found out I was a perfect match on all 6 factors. And you have to match on tissue, blood type, and then genetics. And we matched as if we were family. We never met, and we lived 4 blocks apart. So I use that to motivate people today with Kidneys for Kids in becoming, or if you're a recipient, I should say, that literally your donor hero could be literally around the corner. It's just the need of them hearing your story. Do the testing. We're a perfect match. Just before, I donated to her in January 2013, but just beforehand, we were introduced by a friend who had worked for CNN who wanted to do a documentary on kidney donation and got a mutual to introduce us. And so we'd only met that time, and then they had a benefit for her, and this was kind of surreal. So a couple weeks before that, there's a benefit for her, and I sold the clothing I had for my clothing brand, Carmen Capero, to benefit her. And I'm standing 10 feet behind her and her mom, knowing I'm the donor. They don't know I'm the donor. They weren't told till the day before Thanksgiving. And they said in the newspaper that I should have heard them 4 blocks away because they screamed so loud when they got the call. So for January 11th, 2013, my friend's restaurant drives us together in a limousine to our surgeries, perfect surgery. And that was on a Friday. On Sunday, they wheeled me over to see her. The University of Michigan Transplant Center, where I donated, is connected to Mott Children's Hospital by a bridge. So 48 hours after I'd written down with this little girl who was pale, thin, mostly white, sickly looking. And they went me in this room, and it looks like a different girl. I almost like said, where's Jessica? Full of color and life. And I was hooked. So seeing what kidney donation could do for somebody. After that, I was still working in the construction industry and running this clothing brand. And I became a mentor for the University of Michigan Transplant Center. So my volunteerism is I take somebody through the process of becoming a living kidney donor. I'm their guide. So I've done that for 9 years. And then in 2021, I found out I had to have both shoulders surgically rebuilt after years of construction and heavy lifting. And after my great doctor U of M did a great job, he said, Brian, I can't put Humpty Dumpty together twice without a lot of pain. Time for you to find a new profession. And, I was already involved in this mentoring, and I had been involved in occasional news stories. People asked me, can you help motivate, a donor for me? And it had worked for adults. And my wife and I talked, and I had this concept of helping more children since Jessica was 10. And by then, she was like a daughter to us. She wasn't a stranger. Over the years, we'd gotten, we did pizza parties every year to start her when she was little. We'd go to her school functions. And now, like I say, when she comes home, she's a senior on her first degree at Eastern Michigan University, and she's working at a doctorate in neuroscience. So that's something to see from somebody, that you were strangers, and they tell you at 10 years old they want to help somebody else because they were helped, and they actually do it. So all those things put me into, I researched a little more on what can I do to help others with kidney disease. I'm going to do something else with my life. Finding out there's 2,000 other children today who need a kidney today, and almost 10,000 more on dialysis. So that motivated me to advocate. First of all, it was just a driving trip. I was going to visit National Kidney Foundation offices, hospitals, wherever I could advocate in the summer of 2022. And then we decided to create a nonprofit because there was more we wanted to do. We saw financial needs for families. You've got a child going through transplant, through dialysis, and a lot of medical needs, and a lot of them obviously aren't covered by insurance. So we wanted to do something to raise money for those gaps. So this became what we called Kidneys for Kids, because we are actively recruiting living kidney donors for children by telling stories of these children, what they go through. From my end, I tell now, I just turned 63, that I run around like a 30-year-old with the energy I have. I'm very lucky, and letting people know how safe kidney donation is and how healthy usually we are, because if we're healthy enough to donate, usually we take very good care of ourselves afterwards, knowing we have one kidney, and we tend to have a better mortality rate than the general population because of becoming kidney donors. So I use all that in this recruitment of adults, motivating them to donate to kids. And in Michigan also, just in Michigan, it's like a pilot program. Even though we're called Kidneys for Kids, we do the same for adults. So 2022, I started driving a Chevrolet like a promotion. I had a Chevrolet dealer give me the use of a car for a summer. and I drove city to city, and it became now visits from hospital to hospital. But the first interviews I did were with adults and children, and then I started to get calls from specifically parents who had children who needed kidney transplants, who just heard the word kidneys for kids. And meeting our vice president's son, 2022, I drove into Virginia, and 18-month-old Cooper, yeah, 18 months old, he needed a kidney, and he had no kidney function since birth. So he'd been on dialysis since day one, and I hadn't seen an example, in person until I see this bedroom Casey takes me, and he says, "Imagine, okay, we got the recliner over here. We put a special slit, designed the crib so we can have his tube for dialysis go through it. So one of us sleeps in the recliner every night for 10 hours while he's on dialysis, and one sleeps in bed." Now do that, and it went on for 19 months before he received a transplant. But imagine doing that. There's no breaks. You can't miss a dialysis. It's his life. So seeing that really put, something into my head that, wow, I can't imagine. It was one thing for me to donate to Jess at 10. She got my kidney just before dialysis. But children that are born like this that have no choice from the start and go through years of dialysis is done slower, for a child, usually at home, because you don't go to a regular dialysis center for a child. You go to a hospital or the transplant center. And that means sometimes driving. Jessica would have had dialysis, put it this way, in 2013. It would have been 100 miles each way for one round of dialysis. So doing it at home, it's slower, 10 hours a night, and then it's usually a daily process. So that was the first story we did. We arranged a TV interview for Cooper to motivate somebody to donate. The interview gets called up because the day I'm there, we have all these TV stations coming. This is something I found out about using the press. You can have the best laid plans, but there's a triple murder in Norfolk that day. So where does the press go? They go to the bad story instead of this child who's literally dying for a kidney. So I'm go all the way 1,000 miles home, do the interview by part by Zoom. But when it comes out, it motivated 5 other people who couldn't donate to Cooper because Dad ended up being the donor, the best match. Motivated 5 other people to become donors, and another person to donate a liver to a boy he couldn't donate a kidney to. So that did it. So then it became now yearly annual trips. I mean, we advocate all year long. I'll tell you a little more about the television station in a second. The trips take a special meaning now because we've done about 50 different TV interviews over 3 years. So now it's I plan ahead. I set up a transplant center. I drive to this city, this city, this city. This year it's 12,000 miles, 31 cities. So the TV interviews are done now at transplant centers. So that way you have the care team there, the family, the child, and it really brings focus into everything that's going on. So in doing these interviews, we've motivated 13 people to donate kidneys in the last 24 months, or yeah, about 24 months. And then kidney donor 14 is testing. And it's a lady right here from my hometown in Michigan. I can just say it, or a person, the lady. But anyway, I can't say who. But the point is, she's watched us for 3 years and said, "Brian, one day I get a message 2 months ago out of the blue. I see this little girl you want to help in Los Angeles." And she didn't have a donor. We done this story on her last year that got cut off of CBS at like 49 seconds. She never got any calls because nobody knew what to do to donate to her, no information. But anyway, so here's somebody here who's followed Kidneys for Kids, and now she sees one of our kids on our website. And so she would donate in a paired donation here in Michigan, produce a voucher, and then Abigail would get the next kidney available at Loma Linda in Los Angeles.
That's amazing. It's like a full circle moment.
Yeah, so that's the kind of things that happen. And then we just had parents. The one of the best stories we've had happen out of these children in 23. I did a mile driving trip, and I'm down in Texas, 108 degrees. And in the morning, I tried to get an interview done in Houston. Of course, TV cameras go out to do an interview on the heat. It's 100 degrees in Texas. They wouldn't want to do an interview with the 2-year-old child we had there. So we do our own little filming. I drive on to Austin to meet another family. CBS shows up. I'm outside, family's inside, where it's, cool, obviously with the child. The child's 19 months old at the time, little bear. And they want to film me in the car. I'm sweating. I'm not knowing I had a couple of medical problems at the time I had attended to. So if we get the interview done, and a school teacher sees it in Austin, comes forward, stays anonymous till last summer, and they were introduced live on the CBS Evening News. And then that family just did a PSA for us about how we worked with them until this kidney donor was found. And that's been our best story, so far to motivate others.
That's
So
incredible.
yeah, so that's what Kidneys for Kids is about: is recruiting donors for children, and then we provide up to $1,000 grants per family per year, and that's for costs not covered by insurance. And that's national. Yes, we have applicants from all over the United States, and now we have a regular registration system for families who want to register their child. When they register their child, we'll develop a profile for them, their stories, put up their links on our website, and then we go the extra mile now because we have this wonderful TV network that we've developed over the last 3 years.
Tell us all about it.
So yeah, and this came out of stories like Cooper's. Get somewhere and you can have the best laid plans, and then the press doesn't show up. So how do we make up for that? Well, I would go take maybe a couch interview in a studio in a morning show just to get press in that town to talk about kidney donation. So now we've worked on this platform. We have a live TV network of channels that you can watch on Roku anywhere in the world. And by the time I leave June 9th, we'll be on Apple TV and on Amazon Fire Stick. So I'm sitting right now in our studio in Bay City, Michigan. Now, this was a recording studio, audio recording studio for years, and it's recorded, or it's been converted into, there's a 65-inch screen to my left here, and this is a news desk. So when we film with 3 camera, we have shows that are scripted every week on one's called Drive for Life, which is geared towards finding kidney donors for children and adults. We have another interview show, a community action show called The Voice of the People. And we start with local interviews of others doing well, good in the world, running nonprofits. And now we interview people all over the country, and we've done international interviews by Zoom. And we've been on air since February 3rd, and we've got viewers in 14 countries already. And so now, when I go out on this wonderful trip, there'll be an actual cameraman sitting on my passenger seat and filming, the driving part, what goes into this trip. But then when we get to the hospitals, filming the network interviews going on, and then doing extended interviews with the doctors and the families and the children. We're doing events in a lot of towns, fundraisers, and then awareness campaigns wherever we can stop. Any organization that work with us, National Kidney Registry, National Kidney Foundation, at least of Wisconsin, and some of the OPOs that your organization and ours both work with all over the country. We'll be stopping to see you there in June when we come through Denver. And so anything we can do with organizations like yours and them, we're just doing extra interviews and press and being able to put it out live, record it, and then in the fall and winter and spring it becomes a TV show shown in episodes of half hour, an hour, and we'll have enough to go all the way to the next trip. And so for 5 more years, I pledged to do this trip until we reach the initial goal of Kidneys for Kids was to find 100 kidney donors for 100 children. And we'll, hopefully get to that by the time I'll be 69. Kidneys for Kids will continue after that, but I don't see myself driving 12,000 miles a summer across the country. Yeah, I lose the time. Yeah, it's a long way, and it's just like loading in, loading out for rock bands, the equipment and stuff, and now having somebody with me and can do real camera work. But it'll be a real reality series, focusing on, the kidney disease, finding kidneys for children, how we can prevent kidney disease, interviews with doctors and families and medical experts, and just using this, for a platform of good. That we have sub channels under this main channel that carry scripted show. By fall, we're going to have a vegan cooking show from our mutual friend Elaine Perlman coming out of New York City. Miss Lavinia Brooks there, a mutual friend in Pasadena, California. She's doing her podcast show on our network. So having all these dedicated sub-channels under our regular channel and then bringing them in a rotation. So we have fresh television, and we come off, like I say, like a television network. We didn't want to come off like something cute streaming, set up and get that kind of viewership we build with the trips and with these well done shows where you're coming to our network, you're seeing PBS like content, family friendly, that all brings you back to the one point of finding kidney donors for children and adults and promoting organ donation in general, whether it be living or deceased. There you go.
So excited for that. That's going to be so incredible. I mean, it already is, but just to keep adding to it, it's
Yeah.
it's so unique, and just I think there's so many things going on in the world. There's reality TV out there all the time, but there's no reality TV for good. And this is really that.
Right. I mean, real reality TV, when I'm sitting there, we're not going to be cutting out, obviously I try to and never say a derogatory word. We're all not perfect. So it's gonna be, I mean, live and scripted TV. We're not putting dramatics to it like you see in all these shows. I've got no time. I'm sorry. I don't mean to put down reality TV, but I got no time to see somebody in a mask to figure out who's singing behind it or something. That's not reality TV. This is real. This is about actually finding somebody who will share part of their life with somebody else to save their life. In the end, that's what everything we'll do here. It'll all be for good. It'll be content that'll attract a wide, diverse audience, but in the end, it'll bring them to the miracle of organ donation.
And it really is. I mean, the whole gift of life doesn't need any addition to it. It is the gift of life. There doesn't need to be
Absolutely.
any, added excitement or anything else. We don't want excitement, really. We just want a simple, straightforward transplant donation. That's the end goal.
Right, that's the end. That's the end. But I mean, a lot of times, obviously you don't want to look at this. I mean, I'm 65 or 3 now, and losing the hair and everything, but I'm good at getting attention. I kid around with the reporters, and I have a good rapport. I know what I need to say in a minute or 2 minute interview, and like, hey, look over here, giant purple car over here, and then no, it's the kid in front of me. I want you to see. This is the object of the story. I've gotten your attention. I've driven across the country with a car that'll be wrapped to look like a NASCAR full of logos. Everything we're doing is like, yeah, look over here. But in the end, here's the story. Here's the problem. We can take care of this problem. If you're a healthy individual, you're the person that can take care of this. And by sharing your spirit, and like I say, I'm just a living example. It's over 12 years for Jess and I. Say she's 23, working a college degree, doing perfect, no signs of rejection. I run with one kidney, like I got a 448 cylinder in me. In the old car days, I'm one of the old car guys.
That's
So, and I'm
amazing.
very fortunate at this age, and I realize, I see my friends, having medical issues, going into retirement years and keeping up in your health and keeping active. I never thought I would retire from one, and then go back to work at 61 like I did, with the commitment for, years of service to this. But it's not service. It's not a job. It's just, we want to help. We're generally there. It's because our hearts bring us here. It's not about money. It's not about, notoriety. I mean, I could say I've been on TV 50 times the last 3 years or something like that. No, it's about, this is the issue, and this is how we're going to take care of the issue, is using the media
Yes.
to do good, whether they like it or not.
Yeah. Using the assets we have, I guess.
Absolutely.
And I mean,
Absolutely.
I want to point out, like you mentioned earlier on, having a child go through needing a kidney is very different to an adult needing a kidney. I mean, as
Right.
an adult, you know what you need and you know why everything is happening to you. I can't imagine as a parent of a child
Right.
trying to even explain.
Yeah, I mean, and with any disease, cancer or whatever the child's going through, if they're too young to understand, and then I a lot of times, I've forgotten when I started doing these to the main point is pounding it into adults' heads. They see these children I'm with and like, well, how can I help that baby? They think their kidney is like a watermelon or something. It's like, no, you got two little kidneys like this, and we're going to put it right here in the child's abdominal area, and they're going to grow into it. And they can do that usually somewhere between 19 and 24 months, depending on their size and their weight. It's all gauged on that. So, and they're just amazed sometimes when I talk to adults about that. It's like, I never thought. I mean, I never thought with Jess at 10 because she was, like I say, small for her size and frail and not tall as me and everything. And, but it was, yeah, you just see that baby, especially, in a news story. And if you don't know the facts, that you can be the one, it's a direct donation. They think a baby and they think, well, another baby has to pass away and it has to be deceased donation, and that's not true. So there's these factors that I have to remember in interviews to fit in and you're not running away. I get into the personal things too in my interviews. It's like you couldn't have outdrank me in my 20s and 30s. Not that I was alcoholic or something, but I keep up with anybody. Okay, I smoked cigarettes on and off for 25 years. Thank God I quit when I did, and I was healthy and there were no after effects. But with me, you can't use that excuse. You have to let the doctors decide that. I wasn't tested until I was 51, and I hadn't had all the medical tests that men are supposed to have in their 50s. So, I got the test done, and then for a couple weeks, I'm like, do I have something? Is there something wrong? I only go to the doctor if I'm sick. I smoked, I drank. And to find out, you're perfectly healthy. They said my lungs look like a guy half my age, and yeah, everything stem to stern was great. And yeah, that's the benefit. First of all, you get even just by testing
Yeah, you
to
get a whole
find out,
workup.
you have the miracle of life. You have two functioning kidneys, and you're this healthy. And then we're people like me are the examples that take that piece of your life, donate it to a child or an adult. You can live a life just like us. I can introduce you to, there's not enough of us, but a lot of other living donors. Obviously, we have a shortage in both living and deceased donations, and there's various factors that go into both of those things that both you and I are trying to change. But we need more because it's just like these news stories. It's playing the odds. For me, I have to touch, not just have 50,000 people see. I have to have 50,000 people hear one child's story to get down to the people that'll test, to get down to the person that will pass and actually go through the donation. Because I mean, till the last second, you can walk away, no questions asked, and it happened. So yeah, there's a lot of things that I really, have gotten better at. And now I have the backing of we're a member of the Organ Procurement Transplantation Network, OPTN, as you know, which has given us credibility, the ability to work directly with hospitals, the ability to work on health programs with doctors, and transplant centers. So that's getting us more attention and giving us a more credibility when we talk. We always leave everything medical, refer to your doctor, obviously, but we're able to tell you so much more than when this first started back in 2022 that I think goes into motivating donors.
Yeah, and I think I mean, for you, but also for everybody, the science that goes into transplant is consistently changing and growing, and we're getting all these new opportunities for people to donate that hadn't been able to before, or living donation is becoming so much more widespoken. And I think it's thanks to organizations like yours going out and spreading that message, hopefully maybe not the first time they hear about it, but the second or
Right.
third, they might consider that, becoming a donor.
Absolutely. And I'm the guy that just doesn't go away. I keep knocking at your door until you answer. I'm just that guy. Give it up the first time. I won't have to come back the second or third.
That's a great motto. I'm gonna start using that.
And then you and I've talked this year too about how are we going to make somebody want to donate in life to motivate them now, and we
Yes.
want the rest of you later,
Yeah,
you know,
definitely.
to be registered, whether it's through your DMB, however you register in your state, or through whatever register you use, register to donate your organs at the time of death. Because as a deceased donor, you can provide life for so many, at least 8 individuals total, and then so many more little pieces, parts, let's say.
Yeah, yeah. Those tissues go a long way. It's like
Yeah,
75 lives you can save just as a
exactly.
deceased donor.
So yeah, so we want you both. We want you alive and we want you after. But what better? I think Stacy, my recipient's mom, she says it is so heartfelt in every interview she does that what greater legacy can you give than part of yourself, whether it's during your time living or at the end of your life. And we need more and more people to be registered for deceased because not everybody realizes that not every person who passes are an organ donor automatically.
Yes, only 3 out of 1,000 will actually donate who registered. So when you take that, already less list and you combine that down, just like living donation, it
Right,
it gets really small.
right. Because it all depends on the factors of how you pass and maybe something you've had, if you've had cancer or something like that, or, a disease that prevents certain organs or all organs from being donated. So we have to let people know, and we promote that, like I say, just as much as we do living. I think in the beginning we were talking too much about living kidney donation because of the length of time the kidney functions, that we were almost not putting down, but not promoting deceased organ donation. Because, no matter how we campaign for these children, some will still receive the gift of life through deceased donation. And the kidneys were great. And a lot of it depends on the condition of the kidney, on how well it's matched, just like with living, all those factors. In fact, I'm about to meet, I've spoken to a gentleman in Maryland this year, 49 years with a deceased organ. He's the longest living person right now with a deceased donor kidney. Yeah. So, and I could go both ways. In 2014, I met the Ottenbacher twins. They were the first people transplanted in 1964 at the University of Michigan, twin to twin. But 50
Yeah.
years later, they were still
Yeah.
running great.
That's
You know,
incredible. And that's another one that people, don't realize a lot with living donation. I know I've heard it a lot, is that it has to be family related. I mean, there's still
right?
a lot of people who don't realize, you don't need to be of any
No,
relation to your recipient.
no, exactly. Like say Jess and I, it's a story in the newspaper. You see people putting signs in their cars now, billboards, any way they can. I mean, if you're on dialysis and you've got the average lifespan of 5 years on dialysis, you need to find that kidney. You're going to do anything you can. And that Jess's mom Stacy was a great example of that. She said, I didn't care, pride or anything aside. What can I do? And there was that pink construction paper in the corner. And it's like, I'm just gonna make a sign and hey, this
Ask.
is this is what I need. Please help me.
And
I
I think
can't lose my
families
daughter.
are much better at that than maybe say individuals. And
Right,
as an individual asking, I think candidates get a little more pride comes into play a little bit, and they don't want to put their
right.
hand up and say I need help. But families, they will do anything to get
Absolutely. I mean,
that love.
yeah, if it's your child, it's a life or death situation, of course. But yeah, then trying to get more of us to realize that, in becoming donors, what if it was your child? What if it was your family? Wouldn't you want someone to do the same for yours?
Help your neighbor.
Absolutely. I mean, it truly is only fair. I mean, how we get parents, for example, and this is a difficult one I found to work around is first thing I've got to ask to parents is, have you both and have your family members tested, your friends? Have they been asked to test? Why haven't they tested? First thing I'll get is, we don't match. And I shake my head and say, wait a second. You've gone through the testing for your child already to get them registered for a kidney donation. Your hospital hasn't talked to you about paired donation. I'll get that from parents. It's like the kid's already in the program and they don't even understand the term paired donation. Is like, well, I don't match them in blood type, so I can't donate. It's like, then you're not getting out of it that easy. And if they tell me that, it's like, okay, you're asking me to do a news story or these other things to attract a living donor for your child, and you're not willing, for whatever reason, to go all the way to test for your child. Maybe it's you have to lose a few pounds, to be in the BMI range or whatever. We've had parents go through that. I mean, yeah, I do. Okay, the doctor tells me you lose 10, 15 pounds, you can become a kidney donor as opposed to now you can't. You're not going to do it. How can you ask me, how can I ask the public to come forward to donate a kidney to your child? You have to be the most willing person in the world, or there has to be a specific medical reason why you cannot donate. It's because the press is going to ask that. Other people are going to ask that. It's usually the first thing in post when we post people. Have mom and dad tested? Have you
Yep.
tested? Something like that.
Yeah. You want to
So,
clear those right off the bat and say, yeah,
yeah,
everything's been done. We are, this is last
right.
resort.
Absolutely. Yeah, this is the last resort, obviously, is a transplant. And you have to be totally willing to do it and to support it as a parent, family member, friend of a family, whatever. You've at least have to pose those questions and find out if there's a yes or no and why there's a yes or no.
And I know there's a really cool new program, and I can't remember which hospital it's out of, but it's called Project Donor, that are helping support those who've been turned down from living donation for reasons such as being overweight
Yeah.
or smoking, and they're helping provide, the ways back to becoming able to be a
Becoming
donor.
it though, becoming healthy,
Yeah,
yes.
yeah,
And then there are programs now too. I mean, companies working with kidneys and therapeutics to where the kidneys are lasting longer after they're harvested. And other organs are being able to have a longer shelf life, let's say, to be transferred longer distances for transplant. So there's so many things happening in transplant, whether it's living or deceased organ donation, that are furthering it. But first of all, we have to have willing participants
hmm
on both ends. So, and that's our big thing. We have 100,000 adults and children today who need a kidney. Say 2,000 are kids. But out of the pool, and mostly obviously adults, but 13 are lost every day while they wait for a kidney. And a good example of that, and this is more adult thing oriented, but our president, Jamie Nichols, she had polycystic kidney disease for 26 years. And between the time we did a TV interview for in 2019 until she received a kidney, or 2018, she received a kidney in 2020. But during that time, she started with 24 people in her circle on dialysis. You know, usually if you're dialysis, you go at the same time, same day, so you end up knowing the people around you. And then you see these people disappear from these seats. And by the end of that 2-year period, the only two people alive out of those 24 were her and another girl's mother, who now we're helping that lady to find a kidney for. So that gives you the seriousness of it there. You know, the average is 5 years in dialysis. It's very taxing. It's life-saving. We don't obviously put down dialysis, but it's a bridge. You know, it's very hard in the cardiovascular system and on other organs. And, you know, the sooner you get to transplant, obviously, the better. And avoiding dialysis for a child. Preemptive transplants are the best for a child.
Definitely. And as the kidney crisis is growing, the need for kidneys is growing.
Yeah, not going in reverse, unfortunately. Next year, we're going to have 2026 to go along with the transplant games. I just thought it would be a great year to do it because we had a late start on the thought of it this year. We've never ever passed 7,000 living kidney donations in 1 year in the United States. We get to 6,500, 6,800, whatever. For whatever reason, we never cracked 7,000. So 2026, after doing this trip for the first time with the cameraman, we're going to promote the Run to 7,000. So being able to come to the transplant games and see you guys next June in 2026, and hopefully combining a lot of organizations behind this to reach that goal. I think that would be huge. You know, it's not that we haven't been close, but it's a milestone that's, for whatever reason, never met, and then we've got to go beyond it in both deceased and living until we get these people off the list. A lot of it's education, getting more people, like I say, educated and willing to donate. These living donor protection acts in different states, and now we've got it on the floor of Congress for a national living organ donor protection act, possibly to pass this year, and that gives financial assistance if you become a donor. Time off from work, you're guaranteed your job back, and no exclusions from health insurance or any kind of insurances. So getting those acts passed in different states we've already done, but nationally, it's very important. And then like Elaine Perlman's work with the End Kidney Deaths Act, to get that passed because it isn't compensation. When somebody donates a kidney, everybody in the room is getting paid except for the person laying on the table.
Thank you so much for joining me on the show.
I'm so glad to come out. I can't wait to see you guys in June out in Denver.
Me too. And then before we leave it off, I always ask my guests, if you were to leave our listeners with one piece of advice surrounding donation or transplant or what you guys do, what would it be?
Well, then just remember, I think I touched on this, you can't leave a greater legacy than the gift of life. And we can only ask people to do something if we're willing to do the same thing. So imagine yourself with a child or with an adult who needs an organ transplant, whether it be kidney, liver, lungs, whatever it may be. And, you're going to do whatever you can to get that person or yourself that organ that'll save your life. And please just think about that. You need to do the things in life for other people that you're asking to do for you. Do unto others as you would, want done unto you.
Yeah.
So please consider that. If you're healthy, if you're walking around, in my case, we're recruiting kidneys. If you have 2 kidneys and they're healthy, I want one of them because I've got a child somewhere in the United States that needs that kidney right now. So, follow us if you can, Kidneys for Kids. Go to kidneysforkids.org. Follow the trip this summer, support us, and help us get these children off the transplant list.
Amazing. Thank you so much for joining me, Brian.
Thank you for having me, Anna.
It's been a pleasure, and we will see you in June.